Gastric bypass surgery is one of the most long-standing, tried and tested weight loss operations available. This operation produces fantastic long-term weight loss. Its results are established in multiple international studies, and it's now one of the gold standard procedures.
In the first part of the operation, we make a very small compartment at the upper end of the stomach. And then once we've done that, we bring up a portion of the small bowel and join it to that small pouch of the stomach. So when you eat or drink, food goes down your gullet into that small pouch of stomach and directly into the small bowel, bypassing the lower part of the stomach and the upper part of the bowel.
There are fairly clear guidelines which help determine who is suitable for weight loss surgery. For people who are eligible for surgery, which would be a BMI of 40 plus or a BMI of 35 plus if they've got some weight related problems such as diabetes, the risks of carrying those diseases or the risk of developing those conditions are higher than the risks associated with the surgery. In other words, it's safer to have surgery provided they lose weight and maintain weight loss than not.
In terms of the side effects from surgery, the patient may experience some slight nausea and perhaps some difficulty taking sloppy foods in the early few weeks following surgery, but these will rapidly settle. It's important for a patient following a gastric bypass to make sure that their vitamin and mineral supplementation is adequate. One of the advantages of being part of such an experienced team as the one here in Leeds Nuffield is that we will constantly monitor the situation in respect of these vitamin and mineral requirements to make sure that the patient remains safe.
The bypass operation usually takes about an hour and a half. Generally speaking, people would often a little bit sore from the wounds initially. We expect patients to be up and about pretty much straight away, and we'd start them on fluid and then work through purees, soft solids up to solids over the first few weeks. The first time we see them in clinic, which would usually be about 5 or 6 weeks post-op, we'd expect patients to be managing sort of soft solids, mince, that kind of texture.
Many patients who are overweight have acid reflux. And if acid reflux is a problem for you, then give serious thought to the bypass, because the bypass is in its own right a very good treatment for acid reflux. So if you have an illness like diabetes or high blood pressure or high cholesterol, and you want the maximum assurance that that illness is going to be cured or your medications are going to come down, and you want to get the maximum weight loss out of it, then the bypass certainly offers you greater assurance of that.
Most patients do extremely well with this operation, and if they commit themselves to the necessary dietary changes that are required and undertake regular exercise, they really can lose a significant amount of weight, enjoy a much better quality of life, and have great long-standing improvement in their associated medical conditions.